Hello, this is Suzanne Kellner-Zinck from Done Visions Hypnosis, here to speak about males with eating disorders, anorexia and bulimia. Earlier, I was doing the first part of this subject about the famous people we know who have fought eating disorders, men. And I lost the part where Elton John spoke about his issues, and I just found the whole bunch of them that I wanted to bring out because some of you may actually know these people, and it will feel better knowing that you're not alone. Okay, so Dennis Quaid is an actor, and he had a battle with anorexia, as he put it. It began when he lost 40 pounds to play dying Doc Holliday in the 1994 movie Wyatt Earp. He told Best Life magazine, "My arms were so skinny that I couldn't pull myself out of a pool. I look in the mirror and still see a 180-pound guy, even though I was 138 pounds. For many years, I was obsessed about what I was eating, how many calories it had, and how much exercise I'd have to do." He did indeed recover after getting treatment. Billy Bob Thornton, the Sling Blade star, told the LA Daily News in '98 that he got anorexic after doing the movie U-Turn. "Frankly, for a while there, I think I had a little mental problem. I got anorexic, of course. I denied it to my girlfriend." Yeah, it is a disease of denial, just like drug addiction and alcoholism is. So he denied it to his girlfriend, Laura Dern, and everyone else who said I had an eating disorder. The actor said he lost 59 pounds, going from 197 while doing U-Turn to 138 for the film Pushing Tin. But Billy Bob put some weight back on and is healthy now. Elton John, this is the one I was looking for previously and I couldn't find. All right. Apparently, when he was doing an interview on Larry King, he had talked about his past bulimia. He told USA Today that his attempt to overcome it was aided by a close friend who also had the condition, Princess Diana. Elton John said the two would compare notes on their bulimia. "It was nice to talk to someone." "Oh, you did that too?" Elton admitted, and she said it was so awkward to run to the toilet after the meal. "It helps you feel not so bad about yourself, and it's a little bit of camaraderie." The musician kicked bulimia and cocaine addiction in rehab in 1990. So those are the ones that I could not find before, to let you all know that you are most assuredly not alone, and people have been fighting this stuff for a long, long time. Probably for hundreds of years. And men having to do it pretty much silently because they're taught to keep their feelings in so they can compete in the world of work. So there you have that. Now, another situation that I wanted to talk about in this video was the whole idea that men and women do think differently about things. It has to do with the fact that men have a lot more testosterone and women have a lot more estrogen, and I can't think of the other thing. Estrogen and progesterone. Women were built to have babies and bring them up. They need to be very social, and they're socialized to be social and to be able to have feelings so they can empathize with their kids and fulfill the kids' needs, emotionally speaking, so they grow up to be healthy. Men, on the other hand, are really more into solving problems and thinking thoughts, but not really feelings. If you ask a man what he's feeling, he'll look at you as if you're absolutely out of your freaking mind because he doesn't have any feelings. Unfortunately, most of the cultures tell men they're not allowed to have sadness or fear. They need to pretend not to. And of course, that causes a lot of problems. Eating disorders may be one among many that develop as a result of that ridiculous notion that men don't have feelings. But they do think differently. So we need to take that under consideration when we're working with them, because it is about how to help them heal in a way that works in the way that they think. So if they have a goal, and most men do have goals, I can work with them from the perspective of what their goal is, which is a really beautiful thing, and help them to do it in a safe and authentic to them manner. And that's what I do with all the work that I do with all of my clients. It's really about getting to know who they are individually, interacting with them in a way that works for them, and to respect who they are as people and what they want to achieve as their goals. And I don't mean just the goals of letting go, in this case, eating disorders. I'm talking about the things that they'd like to do with their lives. Now, of course, if I have a high school kid, he may not know what he wants to do. College age may still not know what they want to do. But there are things that are appropriate for their age that they'd like to do. So they don't have to know what they want to do for their life's work. Most people change not jobs, but careers 6, 7 times in a lifetime now, because technology changes up things so quickly that it's necessary. Think about all the things that people used to do that are no longer available to be done anymore. Like, you have administrative assistants to help executives, but you don't have secretaries as much anymore, because most people in the business world are supposed to take care of their own paperwork via the computer. It doesn't matter what level they're at, unless maybe they're in the C-suite, and then they have more help. I'm trying to think of other occupations that have gone away, but you know what I mean, because with technology, so many things are no longer necessary. I mean, right now they're talking about having driverless cars. So that's a problem. You have a lot of robots in factories, so you don't need factory workers anymore to do those jobs. And there's even a robot that was doing some work in McDonald's, bringing the food to the table. A lot less expensive than having actual people do the job. They don't take time off. And there's no workman's comp. What could be better? So in any case, because of technology going ahead so quickly, people do need to change careers. So to have a young kid know exactly what they want to do early in life is kind of ridiculous. It's all transitions, people, all of it. You might find a profession, as I have, that really is very adaptable to your personality. It fits perfectly for your personality. I'm really lucky about that. But it did take me 23 years to find the world of hypnotism. You know, I was a secretary, and I can't spell, and I don't know grammar too well. Thank God for Grammarly these days. That helped me get my master's degrees. And that really sucked. And then I got into working in mental health, and there were just so many things that I hated about conventional mental health, most of which was based on both the over-medication of symptoms that didn't need to be over-medicated, blaming the clients for the problems they had that were the symptoms, that were the reason they were in the programs that I was working in, and not really being given choices as to what they wanted to do with their time off in some of the programs. I didn't think these people had the ability to decide that, which is absolutely untrue, because the very first program I worked in was a social program for mentally ill adults. Every Thursday, they came up with ideas, they chose one, and that's what we did for the Saturday trip. And I had the honor of taking them on Saturday trips. As a 5-foot-tall female, a little thinner than I am today, and driving them to wherever. And I never had a problem. Even when I was taking the guys from the hospital as they were releasing guys into the programs in the communities, as they were shutting down the mental hospitals, they were really, really well behaved, especially when it was raining really hard. I just let them know if they wanted to reach the destination in one piece, best to let me concentrate on the driving, and they did. So what I can tell you is that I needed a way that was more holistic to help my mental health clients. And so doing, I got my own help in clearing my bipolar 2 with timeline therapy. It's a form of neurolinguistic programming, which is a form of hypnotism, actually, because we're using the unconscious, subconscious mind to do the work instead of the conscious mind, which is what the conventional therapists do, where you reason, rationalize, and judge everything, which makes it so much harder to truly transform your life. I'm going to have the information for how you can reach me on my contact information and my Facebook pages. So if you're interested in finding out more about the program that I have to help you, you may do so. Well, I guess that's it for this particular video. As always, I thank you for spending your time with me. Till next time, and have a great day. Bye-bye all.